Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Clinic, Istanbul, Turkey. Today we are going to do the evaluation of the results of the patient who underwent a hair transplantation surgery in our clinic 14 months ago. It was a 35-year-old white male who had a neurotype 4V of the hair loss. As I always tell throughout my videos, one of the most important things we do when we do the planning of the surgery is staging or the grading of the hair loss the patient has. And for this purpose, we use the Norwood-Hamilton scale. And on Norwood-Hamilton scale, the male pattern baldness is graded or staged from grade 1 to 7. 1 meaning no hair loss, and 7 meaning the most of the hair loss. According to the Norwood-Hamilton scale, the patient had the type 4V of the hair loss. 4V means the loss of the continuity of the front hairline, deep receding on both sides. There is some hair loss on volume in the front mid part and the mid scalp of the head. And also there is a spot in the crown area. That's what V stands for, meaning vertex of the crown area. When you look at the pictures of the patient, it may look that he doesn't need too much graft or he doesn't need big surgery, but it's actually at some point mistaken. Why? Because the longer hair, just like a curtain, masks the open area. But when we come through the open areas, we can see the empty spots and deep receding sides on both temple corners. So the patient had a 4,200 grafts transplanted to his recipient side. Out of this number, 3,950 of them were transplanted to the front side and 250 of them were implanted to the crown area. One of the challenging points about this patient that the patient had both hair loss and hair thinning or miniaturization. In some areas, we had to do the full coverage of the open areas where there are absolutely no hair. In some areas, we had to do the procedure called densification or going in between the hair. Basically, it means the next. When we couldn't do the implantation, let's say these are the hair follicles that grow close to each other. And this density is okay. But when you lose one of the hair follicles, there is an empty spot here. So we can do the implantation here. But sometimes the challenging issue can be the next. The density is good. The problem is that the hair follicle itself is losing its volume. And this is called miniaturization. It's unique to the androgenetic alopecia. It means the loss of the volume of the hair follicle. And because the density is good, the only problem is that the thinning of the hair follicles, that's why you start to see the skin of the head. And if you try to do the aggressive implantation this side and go in between the hair where there is no gaps, there is a higher risk you're going to damage the adjacent hair follicles. So when trying to put one hair, you kill two or three of your own ones. So it's irrational. So you have to be very careful for this type of patients with the mixed type of the hair loss when there is a really open sides and where are the areas where the densification is needed, especially for this patient, is the upper sides of the temples and the crown areas. So here you can see 12 months results of the surgery. The front side has been fully restored. The hairline is conservative, meaning the starting point is high, the corners are slightly high, and go with the right angle of around 90 degrees. That gives a more masculine and mature outlook of the hair. And the most important, it looks very natural, because one of the biggest mistakes we see throughout our practice is that unnatural hairlines that are not built according to the rules of the hairline restoration, like age, ethnicity, face anatomy, height of the forehead muscle, donor area capacity. So you can see the front hairline is fully restored, the front side is fully covered, the full thickness of the hair here, and the crown area has been restored. There is a small spot there, but it has recovered itself. Also, the patient was advised to stick up with the medical treatment, finasteride and or minoxidil. We advise the medical treatment because it's a complementary and good treatment for the man who have androgenetic alopecia. We always tell the patient like this: the hair transplantation surgery is like a puzzle. You have the hair loss, we fit it in. But if all the time non-transplanted hair continue to shed, you may end up with new empty spots. So the surgery basically, as I always tell, needed to cover these open areas, and the medical treatment is needed to prevent further more loss of your non-transplant hair. They should all actually complete each other. Otherwise, with no medical treatment, the patient goes in the eternal loop of hair loss surgery, but the donor area is not endless, so we cannot go for the endless graft at this area. So the best idea here is the best surgery is not having the surgery if you can fix it with the medical treatment. Thanks for your attention. Stay tuned, and if any questions you have, you can ask them at the bottom in the comment side. Good luck and see you.